Happy Thursday, Ability. In this science education heavy week, I kind of want to step back today and help us to realize a little bit of self-reflection in how our education is actually going. And the phrase I kind of think of is, how much do you care? And what do you care about? How much do you care that after you go through the cascade of stress responses that your body goes through that are unhealthy for you, that your patient can recite back to you after you raise your cortisol levels? How much do I care that my patient understands the role of a muscle spindle? And how much do I care that they can tell me what a subluxation is, much less pronounce it? Do I care about those things, or am I more concerned and more worried about driving home the point that the adjustment helps a whole hell of a lot more than they ever thought? We're trying every day to get out of neck pain, headaches, and back pain. We talk about it to our patients so often that I want us to kind of do that self-reflection and see, and maybe even ask the patient on the way out today, hey, what did you learn? What do you remember about what we talked about? And if they can't necessarily say, yeah, I do remember exactly what you said about stretch receptors and how those are affected, but they can tell you that, you know what, I think that when I get a little clumsy every now and then, I'm going to think of adjustments more often. That is what we're really trying to drive home. Not so much each and every little aspect of the science behind the adjustment. It's necessary to talk about in order to deliver that message to the patients, but the message is that the adjustment helps so much more functionality-wise and to thrive than they ever thought possible, than they ever allowed themselves to believe. So hit some amygdalas, get your point across, however that may be, give them the bits of science that we talk about, and have them tell you what they learned, and more importantly, how they're going to apply that to themselves and go in and spreading the word to others. Have a great Thursday.